my hope that this event helps us to support that end. It will also allow all of you to get a glimpse into the varying trajectories that are possible to incorporate social impact into your own career and life's work. In the interest of time, I will not read bios now, but through the course of the questions, I will invite panelists to introduce themselves and their work. The initial conversation will be about 30 to 40 minutes, and we'll leave time for questions using the Q&A feature on Zoom, so you'll be able to type your questions in there. If I will take a look at all those questions, see what I can weave into the conversation where possible. So with that, I'd like to jump right in. Hi, panelists, thank you for joining me. In my conversations with each of you, the theme of technology emerged, both as a catalyst to help us solve challenges during this pandemic, as well as a barrier to reach those most in need. And particularly, this is an issue right here in the United States because 30% of adults with household incomes below $30,000 a year don't own a smartphone, more than 40% don't have broadband services or a desktop computer even. So I will ask you all to just start by briefly introducing your organizations, talk about the role that technology is playing as an opportunity and as a challenge. Usha, perhaps we can start with you since you began your career as a CIO and started meanly to improve equity in education through the use of technology. I know in our conversations, the Rabindranath Tagore quote, "Wishing for a world where head is held high and knowledge is free," is particularly special to you. So tell us how technology plays a role in this mission.
Thank you, Geetha, and thank you, Maitri, for enabling this panel. Meanly is built on technology, but technology was primarily a tool. It is not an end to itself. And the tool that and how it serves our goal for education equity is to connect those who can help students, the teachers, the mentors, and other resources to the students who need them. So, of course, we have the challenge with not everybody having access to it, but there are still many others. There are 80% who do have access to technology of some sort, and our goal is to make it 100% and deliver our services using tools.
Thanks, Usha. Sonya, what about you? What are your thoughts on this? You've also had a really interesting convergence of passions between tech, startups, gender inequality. How do you think about technology and how has it acted as an opportunity or a challenge for your organization during this time?
You know, if you really look at technology, it is leveling the playing field by providing access, right? The internet in particular. And what Usha mentioned, the issue really, and what the statistics you mentioned really is access to that technology, then to access the services. Like, for example, if you take the Salman Khan Academy, you take all of these things, if you don't have it, then it's a big problem. So in the case of Maitri, for example, you know, our helpline calls in the last 10 weeks have dropped from new clients, but in the existing people we're already working with and they've left the violent situation, they've scaled hugely. And the reason why the calls from new clients have stopped is that they're at home with the battery, right? They may not have access to a cell phone or it's being controlled. They don't have access to a laptop. And I think the conversation that we were mentioning that what do you do when processes are made really to use still physical presence, right? Like filling out forms. We give an emergency grant for money, which is given cash in hand to the client. Now, at this moment, to try and help a client who doesn't have a laptop to set up a PayPal account is pretty impossible. So, you know, it's actually exposed all the flaws of access to the underprivileged populations. Plus the privileged where, you know, the violence has significantly gone up during this time. So if you're in a household where somebody's monitoring you, that's another problem to solve. But how do we look at now, it's not a crack, it's just like blown up open for us, right? That how do you give access? Now I work in tech and I have always the latest technology, but sometimes I really feel that I work in this holodeck created by the fantasy of brilliant minds, but then what happens to people who don't have it? Who don't even have a phone, which is so unbelievable. In my house, there are 3 phones, 3 iPads, 3 laptops. But what about people who don't have access, right? So I think this is something we really need to start looking in deeply. about access to that technology and then knowledge.
Yeah, it's just hearing you describe it, the mental strain on your clients during this particular period, that sense of isolation. You know, Sarita, this is an area I know you know quite a lot about with your background as a psychotherapist, and you've been so passionate about access to healthcare and behavioral healthcare, particularly for those impacted by poverty and mental health issues and trauma. What about Aki? How is technology playing a role during this period?
So thank you firstly for having me here, and thank you to Maitri for making this possible, and thank you for all the technology that is making it possible for us to talk to so many people out here today. So I would say that we were already working on a telehealth sort of policy and putting some things in place for people that have difficulty being able to get in-person services. But so our healthcare services, our primary care, of course, provided on site. But most of our clients are making less than $25,000 a year. And so these are not people that have broadband access or have fancy equipment in their homes, or like Sonya said, even smartphones. So, engaging them in services is very, very challenging. We did do the best we could to pivot as fast as we could, but all the challenges that got exposed were very eye-opening, even to somebody who's been working in the field for a very long time. We do mental health services, so try to do therapy with a child that has ADHD on the computer. That's a weird kind of challenge. Privacy is a huge, big issue, because our clients don't live in, bungalows. They live in small homes that are overcrowded. How do you do therapy with that? And then our staff don't live in big homes either. And so they don't have privacy. Plus, many of them are young with young children, having to homeschool your child and, make sure that they're occupied while you're trying to attend to a client who might be suicidal, or might be having a very serious health issue. Just all these things that one doesn't think about. And, then we have also severely mentally ill clients who are paranoid and they don't want to talk to somebody on a camera. So, how does a psychiatrist prescribe medication without actually setting eyes? So people were willing to talk on the phone sometimes, but they didn't want to talk, through video. So we had to become very creative, and we did bring some patients in. And so what we would have is that the psychiatrist is sitting in one room, and the client who doesn't know how to use the equipment, we did have a staff person in full PPE sitting next to that person and enabling the Zoom conversations in different rooms. So, you just sort of have to be creative and pivot how you can, because the need is so great, and particularly around, critical health care as well as mental health care, or domestic violence for that matter. You can't not serve these people. So you just have to be creative and do what you need to do, and use whatever technology you can.
It's particularly interesting to have this conversation on technology sitting in the heart of the self-help.
Yes.
It is shocking, actually, to see the lack of access that we don't consider. So when, the COVID-19 broke out, the pandemic, and we had the official shutdown, and in Verizon announced 60 days of free internet access for students who didn't have internet. But I thought to myself, did they figure out whether those kids have access to a laptop or a computer? Right. Offering this free is fabulous. Okay, everyone's doing it. I'm so commending all of this. But let's go down this chain of thought process that Sarita mentioned, which is it's the last mile of service.
Right, exactly. Yeah, we just said 40% of households, right, in the US.
Yeah. So so we have the same issue, right? So we have a program with one of the phone companies. They give us free phones at Maitri a year. How do you get that phone to that person? That's another issue, right? The homelessness situation right now. So we have clients now. We are sheltering in long-term motel stays because the situation was so bad that they actually had to get out. Homelessness is going to be a huge issue that we have not even discussed, which is going to be mental health. It's going to be lack of resources. It's going to be poverty and domestic violence. the trifecta, the quadfecta, I don't know if there's a word, but I'll make that up.
Yeah.
This is what we'll all be facing in a few months when things start to open up.
To open up again.
Mhm.
So
Yeah, go
I
ahead.
mean, I want to change gears just a little bit, because you all are leaders of your organizations, right? In addition to sort of being committed to a mission, you have the responsibility of looking at how the organization sustains through this period, how it alters its operations, how it moves ahead, right, and continues to serve the communities that matter, right, to your mission. So could you maybe talk a little bit about how you've been thinking about this pandemic in the context of opportunity? There's this book by Ryan Holiday that I share with my team quite a bit, called The Obstacle is the Way, where he talks about turning adversity on its head, how trials can become triumphs. So I asked the question of how you're thinking about the opportunities that are now available to your organization as a result of the current moment, and how do you think about leaning into those challenges to deliver on your mission to those who need you most. I also just want to remind our audience that you can put questions into the Q&A feature whenever you think about them, and we'll try to get to them as we get through the panel. So Sonya, you were talking just a little bit right before we went to this question. Why don't you start this one?
Okay.
You all thinking about this?
So I think here's the thing. When you break open a situation and everyone is in the situation you're forced to, you have to start thinking differently. For us, the pieces about technology, access to technology, these are tactical pieces, right? We have to figure out solutions like ASAP. But what is long-term? And we've already been very bullish on outreach intervention, and we've done a lot of work in the South Asian community mainstream, pushed a lot of laws along with AKI and other groups. But now we have realized that we had already made this call last year, but doubling down on outreach and prevention. The reason outreach and prevention are so critical, particularly among the youth populations in the South Asian community, is that these are the change makers for the future. These are the people we can influence with outreach and prevention, that every person in the community becomes your sister and brother's keeper, right? And this is how we can actually get sustainable change over the long term. Now, how we deploy this outreach and prevention is a question of technology, being in person, all of those things, we have to sort them out. We got an amazing grant last year for outreach programs, and an amazing shift was made by Maitri staff, the outreach staff, and we are focusing on podcasts, and we are focusing on, conversations with therapists, conversations with many, many different groups of people, youth. I think this is the way we just have to make this as one of the key areas that we move forward with.
Thanks, Sonya. Sarita, do you have further thoughts on that? And actually, we've also had a question come in while you were speaking about the role that being a South Asian woman might play in helping or hindering you. So as you're talking through this, if you have some thoughts on that, please go ahead and address that as well.
Yeah, so, I think the book that you reference is very powerful. One can look at obstacles or challenges as also opportunities. What we're seeing right now is that there is going to be 2 million more people on Medi-Cal come July. So, and that's just probably a small estimate. So the need for services for this population is definitely going to skyrocket. I think that, the governor of New York had made this statement a few months ago or a few weeks ago and said, it seems like the entire population is suffering from PTSD, post-traumatic stress disorder. And I think that that is something that translates into violence. It translates into child abuse. It translates into severe mental health issues. So that's something that we're sort of looking at, like how will we respond to the majorly increased need in the community? How do we gear up at this time while we're supporting the mental health of our own staff and the wellness of our own staff? It's very exhausting, and it's very exhausting to take care of clients through this technology, methodology. But there's an opportunity. The need is going to be there, and AKI has always that's been sort of the philosophy, is that we identify the needs in the community and then we design programs to respond to the need of the community. And so, those are two things that we're certainly looking at in terms of seeing how we will expand care and how we will grow both of those areas. And, we're also doing a lot of work around integration. And so our client who is in the domestic violence program, they can get mental health services, they can get primary care from us, they can get housing support from us, and sort of this holistic view of health for any individual that is coming through us. And we're seeing needs expand in all of these areas. So to me, it feels like there is going to be an explosion, and who better to rise to these occasions is other than, nonprofit organizations.
Right.
So we are the community-based organizations, and it behooves us at this point in time. I feel a sense of responsibility to actually gear up and say, all right, when things sort of start to open up, we have to more and more respond to that. That being said, currently we're losing revenue.
Right.
So it becomes a big challenge because our revenues are based on how many people we see, how many services we provide, how many minutes of service we provide. And that's taken a big hit. So thanks to the PPP loans, that everybody we're surviving here. But the reality is that the whole financial model and service model will have to shift at some point in the fall.
Yeah, I mean, the social sector is definitely, taking a hit, as is everyone else at this point. Actually, there is a question about fundraising more broadly for your organizations during this period and how people can help. So again, as we go through our questions, if there are particular calls to action, ways people can volunteer in spite of not being able to be together physically, definitely let them know. Usha, I'd like to give you a chance to answer this question as well. How have you all seen the opportunities emerge? I know, given the use of technology within the Memely platform, there's more opportunities, right, in terms of new partners and the ability to serve during this period.
Yes, interestingly, both Sonya and Sarita are working on the here and now for their constituents. And what we are looking at is for the future. We're looking at the students, because even if everything else, not that it is, but even if everything else was going okay, if they don't have access to the learning that they need and they deserve, they're not going to be able to get the jobs once they get through on the other side of school. So when we were doing programs pre-COVID, we were working on, again, going to the underserved students, and we went to them, we reached out to them through organizations like Boys and Girls Club and others that are serving this population. And they loved the fact that we were able to bring them a program, a whole program, like an intro to computers and careers. So we put those two together so kids can feel, okay, if I get to know about computers, what are all the different careers I can use them in? It was a different perspective. It was going wonderfully. COVID came and it stopped. All these after-school organizations shut down. They could not serve kids. And then we hit the other challenge of them not having access to computers and internet at home. But what changed for us in just a couple of weeks, thankfully, was the leadership in California stepping up, and all the big companies in California stepping up. So within a matter of a couple of weeks, now we had these organizations contacting us and saying, we are ready. We want to get back to those programs. And oh, by the way, they're not doing any traditional schooling at all. So we said, this is an opportunity. We'll get our mentors, and they're all volunteers from big corporations. And so we'll get them to help, do homework help on top of it. But our differentiation is all our mentors are background check, criminal background check. We can trust them. We record everything. We oversee everything. So when we give something to the students, we feel good that we're giving them something of quality. And then the other interesting thing that has happened is, obviously, as you know, all the school districts where everybody has computers, kids have their own computers and devices, internet is not a problem. Within a week of the shutdown, they were doing full-on regular school from 8 to 2:30. They were doing just fine. But interestingly, we got calls from teachers saying, Zoom is killing me. We love Zoom. Zoom is killing me and my students. We can't just be working on Zoom, but your platform is allowing for a much deeper collaboration between the students and the student and teacher. Can we use yours in conjunction with Zoom? So for us, that was a new opportunity that was opening up. So, for us, technology is technology. And in this situation where everybody wants to stay apart, this is a time when what we provide is of great use to many organizations, even not for students. We've had people who are doing social and emotional learning contact us and say, maybe we can use your platform to do a more engaging, interactive teaching.
But it's really incredible to hear about the ways that you're thinking through the opportunities, right, that might become available during this time. On that note, just given the question that we've had from the audience, the question around volunteering or how people can take action, if any of you do have opportunities for people to do that, could you speak to them now as well?
Absolutely. I'd love to address the 3 questions on fundraising. One of the questions is that South Asians are very predominantly donate back home, right? And, and they also donate according to a survey done by one of the philanthropy organizations to their temple, children's schools, and then back home. And so organizations here don't. I think one of the ways for us to change and convince people that we live here, we need to make the investments here. I'm not saying you don't need to donate to organizations back home. I do, but bulk of my giving goes in the US. Bulk of my giving goes here to the communities that are supporting all of us here. And when we work with youth, and I'd love to know from Usha if they're making any efforts, when we do outreach and prevention among the youth in particular, they're born and raised here. We already have now 2nd and 3rd generation here. Their whole focus really is supporting us here. And I think I cannot stress enough that how much we really need to educate our community about the needs here by providing the value that we are providing. I think a lot of people think, oh, I don't need domestic violence services, or I don't need mental health services, or I'm very affluent, I don't need educational services. But until we put this pivot in everyone's minds that the weakest member of our community is representative of the whole community, not, the affluent person living in a mansion and has had the $500 million public company, right? So I think this is really important, and everyone on this call, I really urge you to get engaged, involved, whatever level you donate at, to whether Aki or Maitri or to Usha's organization or to what Geetha does. It's very important to put our money where we are. And that was my pitch, and I can step back now. I'm very passionate about this.
Thank you. Thank you for sharing your point of view.
Can I add to that? So, one of the things that people often look at nonprofit organizations and sort of this comes like, there's somebody coming with a begging bowl, sort of wanting to, take something away from you in a way. And I totally agree with what Sonya is saying. South Asians do tend to give back to India where the needs are astronomical. There is no doubt about that. But I think that we live and work in this community, and we have to contribute in this community. So, an analogy that I use often is to say that, when people have ideas, business ideas, they need to raise money. All businesses need to raise money, for-profit and non-profit. The for-profits, they have venture capitalists who go there and often invest so much money, which sometimes doesn't go anywhere and doesn't, the company goes under. And there's a lot of, wealth and resources that are put into that. And so to me, it feels like, you guys, you're our venture capitalists who are going to invest in people, in people's lives and in their communities. And so if you think about yourself as an angel investor, then, that's what you should do. You cannot, yes, in a venture fund, you put money in and you see, dollars come out the other end and it makes you feel really good. But if you can think about it as your investment in a person that, is going to yield long-term impact, is going to empower somebody, it's going to make somebody's life a lot better. Really think about it in that way. And wherever you can, contribute your time and contribute your dollars. That's what I'll say.
Thanks,
And
Sarita.
I'd love
Looks
to.
like Usha's trying to get a word in.
Yeah, I'd love to follow up on what both of them said. It's just, it resonates with what we do and what we advocate. So I had written about why everyone should care about education equity. But the points that I make there, it's not just for education. What it boils down to is you may live in a zip code where schools are great, everybody's comfortable, crime is low, life is good. But you're just 2 zip codes away from a place where people are struggling. They're waiting in line to get their groceries for the week from a nonprofit that's giving it to them. And think about your children and your grandchildren growing up in a society where there is so much inequality, when people are not at the level they should be in. You are not going to feel good about that. Your kids are not going to feel good about that. You're already seeing it in your children growing up with a lot more concern about social impact than their parents and grandparents are. So we, and meanly, we are lucky in some ways. We can take your skills in many different levels, your business skills, your mentoring skills if you want to mentor kids, your tech skills if you want to help us build out our organization, and most of all, the way Meemly is built and the way we serve others and the students is we bring our technology, we bring the expertise of educators and teachers, and we also bring the power of community. Community is what helps us push these services out. So anyone out there, if you want to help a handful of kids in your local school, contact us. We will work with you in making that happen.
Thank you. And for the audience, we have a post-event email that will be sent to you that has links to all of these wonderful organizations so that you can learn more. I want to keep going on this thread around your organizations and leading your organizations. A lot of times people think of, and Sarita, you just talked a little bit about, some of the preconceived notions around the nonprofit space. And I think I talked to you a little bit about how one of my big pet peeves is when people tell me that they're going to go to the nonprofit world once they retire. And I've always said that, really good, well-run organizations have to make a lot of the same considerations of effective businesses. So in that context, this is a question from the audience. So I do want to tie that into what you're talking about. How are you thinking about your teams during this period? How do you think about keeping them motivated, reset their expectations, especially as you're pivoting your programs? Are they, motivated to be involved in redesign? How do you think about morale, right? All of the things that large businesses are having to think about at this time are relevant to you too. So Sarita, maybe you can start with that one. I know we've talked about that quite a bit.
Yeah, thank you. So, we, at this organization, we've always sort of considered the employees to be part of the family. We refer to it as the Aki family. And so, we're very flexible in general, and we're trying to be very supportive of staff. But I have to say that since COVID hit, my HR department has gone into high gear in terms of really supporting our staff. So we have 1 or 2, sometimes 3 activities during lunchtime or something like that, which have to do with yoga and meditation. Our board members stepped up and contributed dollars. And so we've sent care packages home to every single employee's home. There are 180 of us. And, this week, by the way, I'm going to put in a plug for this organization. It's called My Green Lunch. They send organic food. We sent boxes of organic fruit to all of our employees, 180 of them, with a little note. from me. And, so we're doing things like that. We're definitely aware that the productivity is going to be half than what it was before. And so on the other side, we're going to our funders and our, grantors and, negotiating with them and asking them to cover costs so that that doesn't become an issue. We've taken a bunch of other measures in terms of, supporting people financially, giving out hardship loans, just because for nonprofits, people are the asset. If you can't keep your people happy, you won't be able to provide the services. So we just went into high gear, not just for our clients, but also to think about the health and welfare of our staff.
Of your staff.
Yeah.
Absolutely. Sonya, Usha, any thoughts on this area?
So I'm going to second everything Sarita said, so I won't go over that. But what I wanted to talk a little bit about is how does a leader present themselves at this time? And I think, at this point, leadership is so critical. And how can you sustain your team with yourself being shaken up? And I can share my personal experience on this. You have to be very realistic of what people can produce. Everyone's journey to getting to centering and stabilization is very important. So as a part of my tech career, I would call all my employees every morning just to check in. It was not to check in their work. And it was interesting, the initial conversations I had, they were always thinking I'm asking them about work. And I would say, no, this is not a conversation about work. I'm asking you, what are you planning for lunch today? Are you going to take a walk? Are you going to get on the treadmill? And there'd be dead silence from the other end. Because I think this is the moment we have to, as leaders, show up. And I myself was unstabilized for a while in the beginning. And the reason I'm sharing this is because I do a lot of these events, on Zoom and all. And somebody said, oh, all these women show up and they look so together and they look so, they're learning languages, they're knitting, they're doing this. And I said, no, I should really share my story. And for 2 weeks, and I thought to myself, what is wrong with me? Why am I so out there? And then I realized that I needed to gather myself together. And every morning I decided what is the most important thing in my day, which is my daily walk. Once I decided that, the whole work, everything, Maitri, everything went swimmingly. But until then, I was like on that death row of, social media news of COVID-19. But what is the other problem for women is that we're blurring the boundaries at home. And I want to say, when you go to the kitchen to get a glass of water, that's not the time to empty the dishwasher. When you are going to the bathroom, that's not the time to change the laundry from the washer to the dryer. When you hand out jobs, they're not going to do them as amazingly as you will. Let it be. And I think as leaders, we need to remind ourselves doubly and tell our people this. And, in the Maitri staff, my own staff, all these things, I thought I knew them always. I've been a leader for decades, and yet I had to remind myself. I had to again say, okay, what is the need in here, right? And I will just say the 3-word mantra is kindness, kindness, kindness. If you are not kind to the people and yourself, you're not going to survive this. That's the bottom line here.
Well said, Sonya.
Well said, Sonya.
I would just like to add one little thing on this topic of how our team is handling this. What I found was giving agency to everyone in the team to figure out how we're going to get through this together, because they're all aware of where we are at, what we're doing, how much money we have, how much money we were going to get that is probably going to dissipate now. But they're all also very vested in the success of the organization. And so now every single one is figuring out how they can do outreach, how they can bring new things in, what more can they do, because they feel they're part of it. And every single one of them has said, working on something like this has made them feel so much better having to shelter in place. It gives them the meaning to get up and do something. So again, I'm very grateful for my team to be able to do that with me, and that I'm able to work with them.
Well, I think a conversation like this and the amount of enthusiasm we've seen around this event shows that everyone is trying to make a social change, positive social change. Everyone's trying to find their purpose. and see how they can deliver social impact in the context of their own lives. We have a question around ROI. I know both Sonya, Sarita, you were talking a little bit about, really thinking about the ways people invest in the social sector and how they think about the return, right, on that investment. This question is about expanding our understanding of ROI in the context of charitable giving, and what types of advice, right, you would give to people who are thinking about that. And I want to pull on that thread a little bit because you talked a little bit about the choices people have to make and the causes that they give to. And whether you're giving locally, whether you're giving globally, obviously the organization I work for works in 16 countries around the world. So people have choice, right? And they think about those types of choices. So I don't want to necessarily get into a conversation around which cause is better, but more about how you think about where you put your investments. How would you all give people advice as they think through that process?
I think the choosing a cause has to appeal to you. You have to care about the cause. You have to care about, whether it's education, domestic violence, mental health, all of these causes are all worthy, and you need to decide that. How do you look at ROI? And this is a question that's been asked again and again of VCs and affluent people in the Valley. They ask because, what is the rate of return of an employee? What is the rate of return of the project? ROI can be really, this is my now philosophy, and I've been thinking about this for the last 20 years. There are two ways to look at it. One is the numbers, right? How many people did you help? How many people did you move into a shelter? From a shelter, how many did they do? Their children are now helped, etc. And I think for Sarita, it's also adding in a lot of different pieces, right? So services, you can count the services. But, we started at Maitri doing an NPS score, and people who work in tech will know what I'm talking about, Net Promoter Score. That means that it tells how many other people would you refer to this product or service. And we do it after 6 months, 9 months after a client is no longer in contact with us. We have an 82 out of 100 Net Promoter Score. A 67 in a tech company is considered unbelievably amazing. So, obviously we're not in the business to make people happy. We're in a business to make people recover and then move on with their lives. And until we start thinking about long-term societal change, the reduction in domestic violence, the reduction in mental health issues, the reduction in homelessness, there is no way for us to look at it. And, to say one employee does 15 therapy sessions is meaningless unless you do really quality work. So it's a very in-depth conversation. It's a very nuanced conversation to have. And you could say your boat is floated by, I'm not picking on anyone, but I think there's like Dil schools in Pakistan. They're amazing. I support them, by the way. They count the number of children in school and how many school hours that they've gone to. I think that's amazing. You have to decide and explore. We are so fortunate. Even if you give $5 to the Second Harvest Food Bank and $5 to a reading program or Boys or Girls Club, you are putting your dollars to work and supporting and making societal change. So the ROI, you cannot look at it as orange. It's not oranges and apples even. It's like, oranges and vegetables maybe. So, but there is an ROI. Absolutely, there's an ROI. You have a conversation with any of us, 4 of us, including you, Geetha, and we will tell you what the ROI is, right? So.
Thanks for that, Sonya. Sarita, Usha, any further thoughts on ROI? As we can move.
Well, you asked an interesting question. Where would you put your money, right? So I think there are a lot of people giving you advice on impact philanthropy or effective altruism, where a lot is based on how far will $1 go. Mm-hmm. So how many people can you impact, as you were talking about it, Sonya? But I think at the end of the day, for a lot of us, giving is personal. We mm-hmm. give to the causes that resonate with us. And I would recommend, even if you're giving to the big causes, start with what makes a difference to you, what resonates with you, a cause that you would love to be part of, maybe when you retire, and think in terms of, is it going to have an impact now, right? What impact, if I'm giving $5, if I'm giving $25, what would it do today? And the ROI is the satisfaction you get out of it. Because every one of us here in this panel, we tell our donors what we did with the money that they gave us. They know the impact that their dollars have had. So take that, enjoy it, appreciate it, and give more.
Thanks, Usha. Yeah, I mean, one thing I always say to people is don't just look at what an organization does, but how it does it. And so that you feel very comfortable that your hard-earned money is being put to good use. Okay, so I'm going to change gears a little bit, given some of the questions coming through here, and learn a little bit more about all of you. You have had interesting and unique ways of incorporating social impact into your lives, either as a clear career trajectory or kind of a hybrid existence, working for both for-profit and nonprofit, or making a full transition from for-profit to nonprofit. And each of these experiences, they present different models, right? And demonstrate that there are lots of different ways to successfully incorporate social impact into your life. So can you maybe talk a little bit about how you've seen those evolutions of boundaries, right, between the for-profit and nonprofit sector play out, right, in your careers? I think this is particularly important for some of our younger audience members who are thinking about their own career trajectories, for those who are thinking about transitioning jobs or rethinking their own priorities and purpose during this time. So any thoughts you have on that?
So I can talk a little bit briefly about my own trajectory. I'm a CMO, Chief Marketing Officer at tech companies, startups, in particular software companies. And I have been also involved in Maitri for over 26 years as a volunteer board member, board president. It took me a long time to even merge my nonprofit career. And it's really a career for me. I have at times taken consulting gigs so I could put 40 hours a week in Maitri. I did this for a period of 5 years for super hyper growth at Maitri, where I worked in tech companies as a consultant so that I could focus on Maitri an equal amount. You know, it was only 5-6 years ago that I started showing both my careers, and I'll tell you why. It's the millennials and the Gen Z. These are an amazing generation of human beings to come on this earth. They care so much. They care about the companies they work at. They care about social causes. They care about so much stuff. And as I went through my career, and people had no idea my Maitri involvement, my Maitri people didn't know the other stuff, I began to talk and I realized, it's all about being a purpose-driven human being. And you don't have to wait till retirement. You really don't. And this idea that my children will go to college and then I'll do this. No, the time is now. Find a cause, write a check. You can't give time, write a check. You can give time, do the time. But what it does for you as a person is that it brings the best of the two to the two different areas. I mentor women in tech because I'm a peer counselor at Maitri and I chose this many years ago. In Maitri, I'm always talking about tech. How can we reach out? How can we do good things? How can we pivot? And at this point, I really honestly sometimes think, I don't know what I've given Maitri, but Maitri has given me such a tremendous community, a cause, a purpose. And, what more can one want in life, right?
Absolutely right. Usha, you had a really interesting story at the moment you were thinking about starting Meemly, right? Sort of this dilemma over whether it should be for-profit or nonprofit. How has that kind of binary played out in your thinking?
Well, actually, why Meemly got started itself, I think, talks a little bit to your question. So I have been involved in some education cause ever since I can remember, as a teenager and younger. And when I was doing my tech thing and I was moving up the corporate ladder there, I was volunteering as a mentor in East Palo Alto. And what I found was it was really difficult to drive at the end of the day, fighting traffic. I had to go there to meet with them for 1 hour, just 1 hour. And they may not have been able to be there for whatever reason. And then, nothing happened and they wanted more time with me. And I realized I'm in tech and I can see the technology is there. So here are the resources, people like me who want to help these students and they need our engagement. Maybe technology would help, which is when I decided to start the company. And interestingly, like we all do, and you went and talked to a whole lot of people about, hey, I'm going to build a platform. And what's different from our platform from everything else is we want to keep it safe. It is really, really important. I wouldn't want my child to be connecting with a mentor who knows all her contact information. So safety is primary. I know I had to go through a background check before I was a mentor. So I want to elevate the same thing to the online platform. And everybody said, oh, you're building a platform. It should be a for-profit company. Absolutely. And I had my misgivings, but I said, okay, this is what we should do. I can still do good and do well. And yes, I can make all that happen. The reality was we were doing a lot of projects, but all our projects were focused on education equity. So we were serving schools in the districts that were not getting a lot of money. And we were serving these nonprofits that also weren't getting a lot of money, which meant we were not getting a lot of revenue. Just very difficult from, attracting venture money. So that's when I stopped and said, what am I trying to do here? What is our mission? What do we want to do? And I had this, not epiphany, I had the realization, we need to put it all together, make it harmonize. What I think, what I say, what I do, if it's all about education equity, I need to be a nonprofit. But I can run the nonprofit like a for-profit, with accountability and being careful and trying to maximize the ways that we can get money and revenue. So that's what we are now, a nonprofit. I'm so happy to be there.
Yeah, thank you. Because it is a very nuanced space now, right? I mean, people are thinking very closely about the different types of organizations that can deliver social impact.
Yeah.
Structure makes the most sense. So thank you for your thinking on that. I did have one very specific question around the elderly. If any of you have programs specifically geared towards the elderly, particularly around access to internet right now. I don't know, Sarita, I wanted to check with you on that one. I don't know if you do, if you could just speak to that real quick, and then we'll have one final question for all of you.
Yeah, so I think, Comcast offers some service called Internet Essentials, which, they offer that for seniors. I think it's maybe $9.99 a month, or at this point in time, it might even be free. So that's something that's there. We actually run a senior program as well, a senior wellness program. So of course, we used to do service in terms of meals for low-income seniors, and we're not able to do that on site. So we've actually pivoted and gone to delivering meals, which is not our way of being, but we are 4 times as many meals are being delivered now. And then we're getting groceries from Second Harvest Food Bank and delivering those as well, and toiletries and so on. But then we also used to offer classes on site, so computer learning classes and all of that. And that's something that we're sort of experimenting with right now, is how do we go using technology and using Zoom to be able to actually teach the seniors in their homes, and not be, so that they don't have to come on site. I mean, a big issue for the elderly is isolation. And so this pandemic is actually causing far more issues around isolation for seniors. In fact, as I was driving over, I was listening on NPR. The forum had a segment on, they had the UCSF professor on there, who's a physician, who was talking about the elderly and the needs that there are. And so, we're trying to do what we can to check in every day. And by the way, that is a volunteer opportunity that some people, I know there's a kid in Saratoga who started doing this, a high school kid who's basically calling seniors to check in on them. And
Samika too?
Sorry?
Is that Samika?
Yes.
Yes, amazing child, by the way, amazing.
Yeah, so, so there are those kind of opportunities that, just call and talk to the person for a short period of time. And of course, we also make sure that, the background checks is done and all that. We won't give out information just like that. But But that combination of, and I wanted to go back to something that Sonya was talking about in terms of mission driven. I think the young people today, the millennials, they're amazing. They care about stuff. They want to be in places where they can make a difference. And this is one way that young people can engage with the older generation and be able to bridge that gap and teach them technology. And we do that. We bring volunteers in sometimes who are from tech companies who are actually teaching the seniors how to use the technology, iPads or whatever. So that's something. But yeah, I mean, if people go on our website, maybe there'll be some resources that they can get linked to.
Thanks, Sarita. One final question around how you think about collaboration, right? We've talked a lot about how there are a lot of causes. There's clearly a lot of challenges that we're all trying to solve in the world. You have here 3 organizations which perhaps have synergies. I'm sure you work with other organizations to help deliver your mission. How do you think about collaboration and ensuring that, as things open up, right, that we're really accelerating our ability to deliver on our mission?
So I'm happy to take that. We work very closely with Sarita and her team, and they work closely with us. We work with a lot of shelters, mainstream, etc. But here are the 3 areas that I was speaking to our executive director, Rama Jalan, about. One, collaboration has to now start happening on tech processes. For example, banking. It needs to start happening on access to tech. It needs to start happening on the resources. So when we have the opening, are we going to be prepared to do the collaboration with tech companies, with perhaps the phone companies, and say tech needs to spread out further? The things that Usha mentioned, that, okay, kids who don't have access to a platform, right, or are not able to get onto the internet. The second thing is safety and access, which is going to become a collaborative, huge collaborative effort. I know, Sarita, you must be on calls 10 hours a day as Rama is, working with the county on homelessness, all of these other issues. So, it's going to take a village of organizations to start planning for the next 6 months, 12 months, 18 months. I mean, if we're in this for the next 3 years, as some people have said, we really have to be galvanizing right now. And the last one is, how do we get the word out about safety, outreach? How do we get the word out about resources? How do we solve this problem that Sarita mentioned, is privacy? How do we solve the problem of children getting access? There's been reports of, pornography on Zoom, and there's been all these. I think tech companies are solving this and they're beginning to understand. But unless tech, for-profit companies, non-profit companies, and leaders come together along with the government, we are going to be in a worse shape 12 months from now. We are in the first phase, right? And it's already shaken us all up. But how do we start doing collaborations all across, vertically, horizontally, in every direction? We have to play multidimensional chess right now. There is no other way.
One thing I'd like to add about that for all of us heading nonprofits is, like any other company, I think we should focus on our core competence where we can. So I, for one, cannot do anything at the level that you do, Sonya or Sarita, you're doing in healthcare. But I think there are opportunities where what we have with our platform could be supportive to your needs, what you're offering to the families of your domestic violence victims. So what you're doing to the elders. We in fact have a program which is going to connect young teenagers to elders and to listen to their stories and write some memoirs for them. So that's the kind of thing, let's work together. But people need to know about us to know to work together. So.
And I'll just quickly add, I know we're running low on time here, but I would say there's no other way to move forward other than by collaborating. People have to be talking to each other and doing this. And, honestly, I did not, I know that you and I met, but here I was even thinking, because we run some after school youth programs as well. And I'm thinking, oh, okay, Memely is a collaboration that I can sort of look at in that way. So there has to be not just, so within the nonprofit sector, there is a lot of collaboration that happens, but I think there has to be cross-sector collaboration that needs to happen, because, as Sonya said, tech companies have a lot to give and a lot to, that can happen, but the needs have to be identified by us, and so that, you know, we can together problem solve that.
Thank you all so much for encouraging more collaboration. I think that's exactly what we need to handle issues so large. There was also a recommendation from the audience around Brene Brown's recent podcast on isolation after Vivek Murthy, which may be of interest to some of you. So I also want to just draw attention to the survey link that we've posted. I ask that everyone who's attended, please provide your feedback. We take that very seriously as we design more events for Maitri. And with that, I'm going to close out and thank our panelists. And just a few final thoughts. Noted leadership scholar Bernard Bass predicted that by the year 2034, the majority of high-level leaders will be women, based on their more transformational qualities. These are qualities like being inspirational and positive role models, demonstrating concern about followers, empowering and encouraging followers to be creative and to take chances. So thank you, Usha, Sonya, and Sarita for demonstrating your transformational leadership today. You are incredibly transformational, inspirational, and you continue to work tirelessly for a better world in spite of these extraordinary circumstances we find ourselves in. I do hope that our audience today will continue to learn more about these issues and about all of our organizations, and think about the very real implications the current pandemic has on social causes we care about. Most importantly, I invite all of you to take action and get involved, and let's help communities make it through this challenging time with hope. Thank you all so much for joining us.
Thank you.
Thank you so much.
Thank you so much.
Take care,
Thank you.
everyone.
Bye.